The outbreak occurred in a gold mine in Kamwenje district. One of the gold miners fell ill and checked into several clinics in the area before traveling to Kampala for further medical treatment. In the process, his caretaker contracted the disease and died.
The confirmed case constitutes an epidemic according to the World Health Organization guidelines.
The Marburg survivor had skinned a colobus monkey a week prior to falling ill. However, this was not the first time the people of the area were seeing this disease.
When we went to that area, we were told by some of the elders around there that they had been seeing, since 1970s, there have been small, minor epidemics of people dying of 2, 3, 4 people dying of bleeding tendencies, very similar to anthrax. You know, where after death, you know, blood just starts oozing from the eyes, from the anus, and so on. So in that area, in that particular neighborhood, it seems there has been small epidemics of this type of thing off and on.
Fortunately, the Ministry of Health, with a team already experienced in handling epidemics, got to work. But they had a huge challenge: to trace all people who had been in contact with the two patients and had scattered around the country.
And because the cases died in Kampala, we had to divide contact tracing into two. We did contact tracing in Kampala, we also did contact tracing in Kamwenje. In Kampala, we identified a total of 97 contacts.
The gold mine was closed and blood samples of the gold miners were collected and screened. The ministry also set up isolation units in the affected districts and at referral hospitals in case new cases occurred.
Now we've followed up all these people. They have not fallen sick. In some of them it is over a month, and maximum really you need 21 days to be able to get infected. So we think that these people, even if they got in contact with the cases, they are safe.
Although not as contagious as Ebola, Marburg too is highly fatal. Patients develop severe hemorrhagic manifestations between 5 and 7 days. Fatal cases bleed from multiple sites, leading to death. So how can one handle a Marburg patient? When faced with this situation, use soap and bleach after handling the patient, or use a plastic bag or kavera to touch the patient's clothing and bedding, and if possible, keep the patient in isolation until they are taken to hospital.
If you can put in a place where there is less people, in some case we prefer that the patient is in isolation, so everybody that is in contact with the patient is wearing some protective equipment.
Since 1967, when the first outbreak got reported, 377 cases have been reported worldwide. In Uganda, 19 cases were reported in Nachibembe village in Bujuri districts in 1977. The ministry is still wary that the Marburg survivor could still transmit the disease through sexual relations.
We feel that this patient, this case who is still alive, could theoretically actually transmit the infection if he's having unprotected sex.
Research has indicated that the virus can be found in semen 67 days after a patient has recovered from the disease. Experts are now studying the forest and gold mine in Kamwenje, which is home to millions of bats, to establish the actual reservoir of the Marburg virus. Although the actual vector is unknown, Marburg is suspected to reside in monkeys and spread by bats and rats. The first outbreak was strongly related to monkeys. The virus is named after the North German town of Marburg, where a laboratory worker who was taking blood from Ugandan monkeys became ill and died in 1967. Agnes Asimwe, NTV.